Allow me to introduce you all to Kantessa if you have not yet met her. Kantessa, thank you so much for letting us share this case and your journey with this case for Mentoring Mondays.
Sure, it's been very interesting to say the least. I've learned a lot.
Now, I think this was the patient that encouraged you to sign up for the Sims course, wasn't it?
Yes, I had watched your flexor tendon webinar with Jen Sager and Dr. Lalonde and Dr. Roulette, and immediately thought of this patient, even though her tendon repair was very far post-op. She was very far post-op, but I thought this might be something that would kind of help finish getting her back to work and back to doing all the things that she wanted to be able to do again with her hand.
How were you feeling when you were going through those 17 weeks? What was concerning you?
Well, I'm pretty persistent. So I was never, like, oh man, this is really bad. I just kept trying more and more things. We did a lot of things with kinesiotaping, cupping, scraping, just thinking outside the box, trying to get movement out of those three fingers that just were not moving well at all. The patient was very frustrated though, and depressed at the point where, it was difficult for her to write. She couldn't use her hand at work to type, and those are vital things in her job. So I just kept trying to think, what else can I do? And then took that webinar, and then I was like, oh my gosh, this might be the missing link.
And her fiance or husband is an occupational therapist, isn't he?
Yes, he is.
So no pressure there.
Right. He actually is doing wheelchair fittings now, but I had given them all the information to try to look up on the Sims technique so that he could read about it, learn about it if he was interested, and then maybe help kind of so that she had some information to look at too. So it was nice that you have those case study presentations online, because some of my patients have actually wanted to see how other patients do with it. And at the point in time that I was starting this with Christy, I had no history other than the resources that you had available. So it was good for them to see other patients who had gone through the program, what the casts look like, what the exercises look like, kind of time frames. And so that was a good resource to have as well to help with patients and getting them on board.
Absolutely. And one can go to the website, robinmidgley.com, and you can get patient testimonials, therapist testimonials, and then, of course, on the social media pages, there's lots of examples. So I think that is beneficial. However, I think you're collecting your own resources now. And
yeah, now I have a ton. Yeah.
No, you haven't.
I saved them all.
So let's just talk about signing up for the course. How did you find the whole experience? From signing?
I felt like it was a very personal approach. In the past, things have definitely evolved over the years as far as continuing education goes. There's a lot more online learning versus in-person learning. And I found that you being able to talk to me I think within a day of me reaching out to you, and then signing up and doing a Zoom meeting where you explained how the classes would work, how the online module worked, all the different things I would have access to once I signed up for the course. It was very easy to follow once I got signed up.
Oh, that's great. I do feel that often is missing with a course. It's one thing listening to the lectures and getting the knowledge, but it's another thing actually applying a complicated technique like Sims.
Oh, exactly. And I think too, when you go to a course, the course is over. And then what do? You have all these questions. So it's been very nice to have the mentoring page, the private social networking page where we can present cases and get feedback from other people who have been using this technique for quite some time. So all of that together has definitely provided a good learning environment. It's not like the course is done and then I have to figure out how to keep using this technique. I have resources that can help me continue to grow, which is, I think, very important to making this successful, me being successful with this technique.
Absolutely. I found in the first few months after I launched the course, I didn't provide that service. I hadn't thought about providing it. And therapists were coming to me months later saying, oh, but I wasn't that successful. And then I looked at it and thought, oh, but I should have intervened and I should have provided you with some advice or should have been there. And that's when I kind of came up with the idea of joining therapists in their clinic to mentor them. How did Christy feel about that when you first suggested it to her that I'll join the session?
Oh, she was on board with trying anything. Like I said, she was frustrated and, at some version of depression, I think, from not being able to use her dominant hand. So she knew that I had tried to get through the course modules as quickly as I could so that I could get to the point where we could actually use this technique on her. And she was on board with it. And I explained to her that you would be Zooming in since you live like on a different continent, and that I needed your help because this was something I hadn't done before. And I wanted to make sure that if I was doing it, I was doing it correctly.
Oh, I'm so glad. I haven't found a patient who hasn't enjoyed me being there. And I
Oh, no, they all think you're so nice.
I find it's so enjoyable. And then this was a difficult case. So I think had you tried to apply this technique on your own, you would have come into some stumbling blocks. What do you think those stumbling blocks would have been?
I think the stumbling blocks, especially, and I still am fine tuning this. I mean, I am by no means great at this, is the time frame on the casts, knowing when to bivalve them. And I think I'm getting better at learning when you need to switch to the cast. But really, I think the most, I think she just used 3 casts over the whole time. Like, she didn't have to have, this is not a real expensive thing. And if you look at the way that I was doing things before, we had a forearm-based dorsal block, and then we made her a P1 block, so I don't think that the casts are very expensive. I mean, compared to some of the things of 17 sessions and having trouble getting the movement out of them. But no, I think that the mentoring helped me a lot with the casting for sure. I needed that. And I don't know that I would have known when to bivalve it, how long to leave it on, when to progress to the next one. So the mentoring definitely helped me understand or start to put together like an algorithm of how the thought process goes along with watching their movements and what's next.
Absolutely. And eventually it will become part of you. You won't be able to separate your Kantessa from Sims. You'll be one in the same, which is so lovely. And then, of course, we moved on to, well, going back to using those traditional techniques that you were trying in the beginning, which was kinesio tape, and then your brilliant idea of using that blue foam piece around the joint.
I cannot take credit for that. That was totally my coworker. We were all kind of trying to figure out after the Sims Club meeting where I had to present my cases, the fellow students or not students, but therapists had given me some other ideas to try. When you watch the videos, you can see that the ring finger is still struggling, and the small finger also much improved, but still not quite into that composite fist. And we were playing around with using like the silicone digisleeves and doubling those up. And then one of my coworkers says, "Why don't you try this foam? It's the foam that you'd use to build up silverware or toothbrush handles or whatever." And so we slid it and put it on there, and it actually worked pretty well. And it was comfortable too. Yeah.
It did. And I think what was really good was how we aligned that joint. And as soon as we got that joint correction, it started to imprint better in the somatosensory cortex to improve a movement pattern. And
yeah,
you were quite surprised by her very abnormal pattern, weren't you?
Yes, I don't think I've seen a movement pattern like that ever. 23 years.
Yeah.
It's unique for sure.
Absolutely. And tell me, how have your surgeons responded to you using the Sims technique?
Our surgeons are on board with whatever helps their patients. So, as long as we get their patients better and their outcomes are back to work using their hand, they're on board with whatever helps their patients.
Have you had to spend time explaining why you're immobilizing to mobilize?
Not as much as I thought I would have to. Not really. No. And I did a presentation showing them some of the outcomes from their patients once I was able to finally obtain some. It takes a few, you don't have outcomes in 2 weeks. So those outcomes, I think, kind of proved to them, how much it can be of benefit to their patients, but not a lot of time spent convincing them. Like I said, they're very on board with things that help their patients.
And they trust you, and that's so important.
I think we have a good working relationship, so that makes it an easy thing to do. We work well together.
Absolutely. I think what's so exciting about this case was that you achieved rapid results. I mean, 2 weeks of Sims, but you only saw the patient once or twice versus 17 weeks. And how often were you seeing her then?
I would say probably 1 to 2 times a week from, I think, December through March. And then we started Sims in the middle of March. And I just saw her last week, and I think we've had 7 sessions.
In total.
Compared to 17. Yeah. So those results came quick once I knew what to do, and this technique, she responded well to it.
Yes, and we definitely owe this technique to Judy Colditz, and thank her for really not only developing it but also scientifically proving it over a long period of time. And I think that cases like this really do add to the literature. So hopefully I can convince you to write up your case reports so that we can.
I'll need help with that. That's a book I haven't opened yet.
Well, the exciting news is, and I can announce this, is that Aviva Wolf and I are going to be starting our writing club, hopefully before the end of the year, hopefully in October.
Oh, great.
That will be wonderful. So we can really just work with her to get our cases published.
Yes, that would be great.
Yeah, so exciting. So Kantessa, is there anything else you want to share about your experience with the patient or the technique?
I think that based on my experience, this was something that, when I was studying to be a hand therapist and reading all of the books and the literature, and I even did a program at Drexel University to try to help gain more experience and more knowledge before I sat for the exam. I just did not understand this technique, and reading about it, or like I said earlier, just attending a single course, that isn't going to teach, as well as I do working in our clinics, experience is what helps you become a better therapist. So you can learn something, but if you don't understand it or how to use it, or you don't have the experience behind when to do it, when not to do it, that's something that I think this course helped me with, because it's given me the ability to keep learning as I go. Even though my course is complete, I'm not done. I have access to people that can keep helping me. And that's, I think, going to make it so that I can be better at this technique.
Absolutely. And I think that was really the vision I had in mind, was to grow a community and grow experts within the community so that we can all help each other. And I've even found that the community is now starting to give everybody ideas and, in a great way, take over from me, because you gain that experience. And on the other hand, I can say that I've been doing this for 25 years, and I feel I'm still having to think about these cases carefully, check my thought process, sometimes second guess myself. It isn't always that straightforward. It is a complicated technique to apply in terms of clinical reasoning, not in terms of actually physically applying a cast. Anybody can learn to do that.
Yeah, exactly.
It's the nuances. It's the small shift in a joint position. Like, for example, in this case with the claw deformity, just by positioning those MCP joints in 20 degrees of flexion, we completely changed the claw deformity and corrected that long term.
Yeah, she still has full extension. There's no claw deformity. Her Sims Weinstein test, I think she is no longer red lined on those 2 fingers, but she still has loss of diminished protective sensation. So her ability to feel is not normal. So that the muscles aren't working that well yet either. But she is making gains with her Sims. So I think that, like the Sims Weinstein, not the Sims technique, but I think that the fact that the claw deformity is still resolved, even though we know those intrinsic muscles aren't working correctly yet, is pretty amazing.
It has been a fantastic incidental finding for me. And with each case that we use this technique or apply this technique to, I'm finding more uses. This is not just a technique for the stiff hand.
Oh, exactly. And I know in your video earlier you mentioned that her fingers were stiff. she had full passive motion in those fingers the entire time. So there was no joint stiffness that I was treating on her. It was just control and limited tendon gliding, I think. Like
Yeah,
control of the hand and the limited tendon excursion because of scarring. So it
absolutely.
definitely worked. Yeah.
It worked. And I look forward to seeing what you can do with this technique in future, because you have a very
I'm
busy,
excited.
you've got a busy caseload and you have a lot of complicated patients in your caseload.
Yes, yes. And it does, I mean, it's not as if every patient that walks in the door needs this technique, but when you find the ones that are not getting better, it's like, oh, here, we're just going to put this and your hand's going to get better. And they make gains so quick. Like, why didn't I do this sooner? But you want to try to give them every opportunity to improve. But in anything else we do, that's the reason why we measure, why we take our objectives data and document it and we look at it. And then when we see the plateau or no change, that's when I'm like, all right, we've done all the traditional things. You're no longer making gains. This is what I think we need to try next. And I have only really had one patient who will not go back in a cast. And I've shown her the data that she made gains when she was in it. Out of it, she's losing motion. I can't convince her, and I'm not going to convince everybody, and that's okay. But at least she was given the option, and it was her choice.
Can I convince you to try it sooner on patients and not wait until traditional therapies failed?
I'm working on that. It's only 4 months, maybe 4 months that I've been trying it. So yeah, I like I said, I have a lot to learn. The weaning phase, I think, is something, when to change to a different type of cast. Like all of those things, I think, take a lot of knowledge that I'm trying to build. I don't have it yet.
Yes, it's knowledge and it's confidence.
Yeah, I have to be able to sell it to my patient. And if I'm unsure myself, that's hard to sell it to them if I'm still trying to figure it out. But that's where I'm using the Facebook page or our mentoring sessions to try to help with that.
Well, I'm so proud of you. And I think that you have really grasped this technique and you're applying it very, very well. And I think you'll only go from strength to strength. So thank you so much for sharing your thoughts with us. And
Well, thank you for developing a way to teach us Judy's technique, because that's helped me so much. I wish I would have understood it better years ago when I was like, I think there's something to this, but I couldn't
yeah,
figure it out. So this at least made it click for me.
oh, I'm so glad. Thank you so much, Kantessa.
Thank you.